Hello, welcome to another episode of Bunny Hugs and Mental Health here on YouTube. I'm your host, Todd Runnebaum. In this episode, I'm speaking with Pam Hutchings. She is from Saskatoon, Saskatchewan, and her daughter, her behavior switched basically overnight, and she's been having a hard time trying to get her diagnosed, so that's what this whole episode's about. She mentions a few things that I think you should know. One is Dubé Center. Anytime she talks about Dubé Center, that's the mental health hospital in Saskatoon. And she also mentions a GoFundMe, or maybe I cut that out. Doesn't matter. The GoFundMe is over. And she talks about functional neurological disorder. And I'll give a little update on this because this was originally aired back in March 2023. And so there's been some updates. So you can watch for that at the end of the episode. Until then, without further ado, I give you Pam.
Well, Taryn, last year and prior to July 29th, like essentially of 2022, Taryn was an incredibly high functioning, all-around teenager in every area. She was like the valedictorian of her grade 8 SAGE class, which is like a gifted learner program in Saskatoon. She did the whole speech and everything, and it was just beautiful. I was so proud. She is a competitive dancer, has won awards. She wins awards in her piano competitions. And I'm not bragging about her. I'm just setting that, although I am, because she's my daughter, but I'm setting the picture of how drastic of a change this has all been, because she wasn't slowly deteriorating and we had noticed behavioral changes. She was like super type A, high functioning. She did have a little bit of anxiety and a bit of OCD that our therapist had started to notice. I had started taking her to counseling. I'm a registered social worker, so I super believe in counseling, and I was already plugged in myself. So I was like, hey, I have this amazing lady. Why don't you come start to see her? She had started on a very low dose of SSRIs, so the meds that are very common to treat anxiety. And so we had kind of started on the journey of like, okay, you're struggling a little bit with some brain health issues, but nothing that seemed to directly impact her day-to-day life. With the OCD piece, I didn't even notice any OCD things, likely because the majority of hers started off with mental compulsions. So then you're not always going to be aware because they're doing things inside their head. And she just... Go ahead.
12 or 13 at that point?
She probably would have been, it probably would have started like 13-ish.
Okay.
Yeah. And so yeah, that's okay. We were already on the process of getting some extra supports in for Taryn. But never did it like cross my mind or anyone in our family's mind that she had been struggling to the extent that it seemed post July 29th. And the reason I say that day so clearly, because we were out on a family camping trip every year. My family does a camping trip. We book a different place, usually always somewhere different. And my extended family, like my brothers and their kids and wives and everything, we all go together. So it's like one of our favorite weekends of the year. And we were on this camping trip. And one evening we were sitting around the fire, and Taryn was like, her and I kind of had a bit of an argument. And she was just kind of taking some time to herself in her room. We had rented little cabins and was doing some coloring. I kind of didn't think anything of it. I was sitting around the fire having a drink, chatting with my family. And she came to the window of the cabin and just called my mom inside. Her and my mom are super close, her grams. And they were having a conversation. Still thought nothing of it. And then I can't remember if it was my mom or Taryn who came to the window, like, you need to come inside. So I went inside, still thinking, oh God, what are they talking about now? And Taryn said, Mom, I'm feeling really suicidal. And I'm a crisis worker, so half of my role is dealing with calls that are suicidal folks. We also at Mobile Crisis answer the national suicide hotline. So I'm pretty experienced in doing suicide assessments and making safety plans. But let me tell you, when it is your own child, it is very, very different. And so, but I also have a large threshold for crisis or things that are upsetting to a lot of people. So I'm able to just stay very calm in the moment. And so I was just like, okay, well, let's talk this through. Like, what are you thinking? Well, she had almost taken her bottle of meds that she had with her for anxiety. And I was like, well, you didn't, you called us. That's so good. Like, I'm proud of you. And she was really scared. And so what I did was I actually went out to my vehicle, and my mom told me later that she saw immediately my face just changed into like professional Pam, and just did the whole, assessment, went out to the car, and I actually called a coworker and was like, okay, this is what's happening. Am I seeing things clearly, or am I like, do I need to like cancel this trip and rush back into Saskatoon? Like, what, guide me. And she kind of confirmed that, yeah, we'll just take away any meds or sharps for the night and monitor, and then kind of reassess in the morning. So that's what we did. My mom took all the knives that were in the cabin and her meds and stuff away. And I kind of stayed awake on suicide watch, I guess, that night, just to make sure she was okay. The next morning we live in Warman. So we got back to Warman, and that's the first time she admitted that she was actually hearing voices. And she had apparently been hearing them for about a month or two prior to that, but they were kind of more just background noise, singing different songs, and nothing that alarmed her necessarily. So she didn't want to like even acknowledge herself that something extra was going on upstairs, I guess. So eventually she did say, actually, Mom, it's not me that feels suicidal. It's these voices that I'm hearing. They're telling me over and over to kill myself. Actually, it was like the way she described it was a choir singing die, die, die constantly. And so I was like, okay, that changes things a little bit here. Humans that are suicidal, plenty of experience, I can handle that. But when we're adding in this whole other element of hallucinations, that aren't induced by drugs or alcohol. She's never even tried a drop or, smoked anything yet in her life. It just very organically presents after one day. It was just very bizarre in my mind. I was like, I don't know what to do with this. So we ended up going into the ER, and they gave us an antipsychotic and a little higher dose of the anxiety meds that she was on, and sent us home and was like, okay, just try this again at home. Feeling that I was like a skilled worker, I was like, yeah, I can handle this. Let's try this. And symptoms just escalated and were very bizarre the very next day. Any chance she had where she wasn't directly supervised by me, she was banging her head on the wall, biting herself. I stepped outside for like 1 second to talk and like greet my mom and let her in the door, and Taryn had found a knife and had already slit her wrist. So it was just like very extreme. So we ended up heading back into the hospital. I think I stayed another night because I had talked to someone and they're like, well, psych won't even be in. It'll be a long wait. Just try and stay at home and go in the morning. So I propped a mattress up on the inside of my bedroom door so she couldn't get out. And I slept with her in my bed, just like wide awake. I didn't really sleep, watching her all night because she had already just had these really aggressive to herself behaviors. And we went in the next morning, and yeah, she really, really escalated. We've coined it the death room in the emergency room. It's just that room that has nothing in it. It's completely empty with just a slab kind of bed. We spent like, I don't know, 48 hours plus in that room, and all our different admissions and waiting in there, because that's where they put the kids that, have self-harm thoughts. So some of my timeline might be a little bit blurred actually, because there was so many admissions and trips to the ER. So I'm trying to keep the timeline a little bit straight, but so she was so aggressive at that point, even towards me, because she was convinced she had to hurt herself. So anyone that would step in the way, she would harm so that she could get to herself. So she was kind of becoming aggressive towards me. So at that point, like, we had to get security. We had to SDM her, which is substitute decision maker, because she was just so escalated. We had to pin her down. It was a very traumatic experience for myself even. And like I said, it takes a lot to rock me, but like having to hold your own kid down while she's sobbing, I don't want to hurt you, Mom, but she can't control herself. And this is all so new to us and so confusing, because her and I had like a great loving relationship. I've been a single mom for 11 years now. So it's me and my two kids. Like, we're, the Three Musketeers, we do everything together. And for her to just have this like massive change in behavior was just so difficult to adjust to.
What was the time frame of her behavior changing and when she started meds? Like, is there any chance that the meds caused?
I have asked that question too, and I've asked so many questions because she had just started on like birth control to help with, you know, female things, and then like just all the hormones. She had been on them though, like, and it was a very low dose for probably over a year, so it was too long of a stretch to be able to relate it back to that. To this day, we have spent many hours investigating and racking our brains like what could have been a potential trigger for this to happen. Like, if was there some hidden trauma that happened that weekend that we aren't aware of? And to the best of our understanding, like, we cannot pinpoint something that caused this kind of break is essentially in her brain. So yeah, it's really frustrating to not know a reason.
Have you heard of PMDD?
No, I have not heard of that one.
So it is, I'm going to screw it up. It's like premenstrual dysphoria disorder.
Right.
Like that.
Okay.
And I've talked to a couple people on the podcast about it. And yeah,
that's something to look into for sure.
There are young girls that get misdiagnosed with bipolar or schizophrenia, and it's actually their body. So what, like the week before they start their period.
Yeah.
I'm also not a female, so I might be scared of this stuff.
Yeah.
So then there's a lot more hormones, and their brain can't process the hormones.
Right. Interesting.
So then, yeah, sometimes it's suicidal. Sometimes it's just, I mean, like, it's more than just PMS, you know, it's more than just irritable. It's like you can actually get psychotic and stuff. And
interesting. I wonder how come no one has, like, no doctor has brought that up yet. Something to definitely look into.
It is something that a lot of doctors don't know about, apparently.
Yeah. Well, we have been down that path with many different options. Like, they have investigated a lot of different things for Taryn because it's just not making sense. I
was going to say, and sometimes birth control makes PMDD worse.
Yeah. So we actually switched to a lower estrogen leveled birth control and we didn't completely stop because she has really bad cramping and stuff. And she was like, well, if we can just try this first step. So we have just recently done that to see, but our doctor didn't think it was associated. I did bring that up though, thinking like, well, she had just started on that in the spring. Like, could that be related? And she really didn't think so, but it's still sometimes, like, one thing that I've really been noticing through this whole experience is, as a mom or a parent or a caregiver or whoever you spend a lot of time with caring for, you just sometimes, I have this like gut feeling that we're still missing a piece to Taryn's puzzle. And that's why I'll get into a little bit later, like, we're flying down to LA to get these testings done because it just, something isn't sitting right, how it just like switched like that. And it's completely taken over our lives for 6 months. Like, that's very much unheard of in my world, for it to be this bad and for no meds to work, which is also another piece of the puzzle that's just very strange. So I'll go back maybe to where I was, just about how her first admission into the Dubé was like incredibly traumatizing. We had to walk the long walk from ER to the inpatient unit, and it feels like the walk of, I don't know, death or something. Like, it just was so difficult. Yeah, it's really tough. And it got easier. We did it many times after that, and it did get easier. But, you know, being the worker that I am, social worker that I am, and having a lot of experience with people who've accessed the Dubé, the adult side, I just never pictured myself walking my own child through those doors. And it was just so heavy on me. And especially because we just had so many questions. We didn't know what was going on at that point. She hadn't received a diagnosis. And we were just like, what is happening? Whereas symptoms just continually kept evolving over these last 6 months from, all types of hallucinations, not knowing who she is. So thinking I've kidnapped her, and her running out the door in minus 45-degree weather, tactile hallucinations, feeling creepy crawlers over her constantly, seeing, dead unicorns, having images of her killing people, thinking that she's been shot and is bleeding out, literally seeing blood everywhere and freaking out because mama or help, I'm bleeding out, like really truly believing these things. But we were told it's not psychosis because she doesn't fit the I guess the parameters for any of the like more personality disorder type of illnesses. So we eventually got a diagnosis of OCD, and just a very extreme case that she would have anxiety and OCD, and that OCD can produce hallucinations. And so, yeah. We were just like, wow, okay. And they were very confident. And so we cycled through inpatient stays. Like, this is her 8th admission. She's in the hospital right now still. So we have seen every single psychiatrist on the child and youth team. They are phenomenal. And every person kind of has their own approach and has like added a little new lens into how I'm seeing things. And a little piece of the puzzle kind of gets added every time you get to ask a new doctor the same questions, because they just have a little more understanding or different understanding than other people. And we added a diagnosis, or they added a diagnosis 2 admissions ago, so around December, or the October one, of functional neurological disorder, which used to be called conversion disorder. And it basically is where your brain, the hardware and structure of your brain is all fine, but there's signals that are, it's basically like a software problem in your brain. Your brain is receiving signals saying, this is like monumentally scary, we can't handle it, and it will produce a symptom, often a physiological symptom. So usually what I've read about and what other people have heard about are people will stop being able to walk, or they'll have seizures that aren't like they don't have brain activity seizures, but like the symptoms of a seizure, or they will go temporarily blind. So a wide variety of physiological symptoms will happen when it's like something in your brain that's sending the wrong signal and then reacting incorrectly to whatever it may be. But Taryn's, I guess, are more psychiatric symptoms. So we're walking these 2 paths of, yes, she has OCD, but now she has this FND, functional neurological disorder, which could also be producing the hallucinations and different OCD type traits. So it's 2 very hard to diagnose illnesses and 2 very hard to treat disorders that she's left with. And so we have been trying so hard to follow the treatment plan. We've tried all the drugs. I have come up with very radical suggestions based on information that has been presented to me, to the doctors, and they keep on ruling things out. And they have tried, we tested for PANS and PANDA. I don't know if you've heard of those, but that's like
I have actually, yeah.
Okay, post-infection kind of thing that can produce these type of symptoms. She was negative. I know that the psychiatry team as a whole has talked about Taryn for hours and hours on end, trying to figure out what's going on. And they really have settled on this FND as her main diagnosis, which it's just a really hard one to understand, because meds actually don't work for FND because it's a functioning problem. It needs to be essentially be rewired in order to get fixed. So yeah, we've just really been struggling to cope with the symptoms, because they're always like, it could be a new symptom, it's FND. So this is how, just identify the problem and then ask Taryn how you can kind of support her, get her to do her strategies. And I'm like, yeah, those are all things and skills and strategies that we've done. We are the strategy masters. We have done absolutely everything. But when she doesn't even know who she is and she's screaming at the top of her lungs, I'm bleeding out like it's a gunshot wound, and then also harming herself. That's the biggest reason we've been back in the Dubé continuously, is because she gets these overwhelming compulsions to hurt herself. So she's, I have everything locked up, but she actually broke into our lockbox about a week ago and took an entire bottle of olanzapine, which is antipsychotics. And at 4 a.m, we had to take an ambulance back in. Like, she can't stop herself when those moments come on. And then she knows she doesn't want to do that stuff, but it's like her prefrontal cortex, the logic and reasoning part of her brain, is completely flipped off, and there is no logic anymore. It's just follow this instinct and must complete this task. Doesn't matter what the consequences are. So even in hospital this day, she's swallowing puzzle pieces. she's drinking bottles of toothpaste. She's trying to do absolutely anything when that urge comes on to harm herself. So it's just so difficult to manage and to understand.
God,
Yeah.
my
Mm-hmm.
heart is, yeah. I'm so sorry you're having to go through this.
Thank you.
It's, I've been following you on Instagram, and it's been, yeah. I mean, I get a little confused with the timelines and stuff like that too, but it's like, but I could tell what, you're suffering and she's suffering, and you're both
Yeah.
have no idea what the hell's going on.
Yeah, basically.
Have you found navigating the mental health system challenging?
I feel like I have been very lucky in terms of the navigating piece, because I know the talk and I know the ins and outs of how the system works. My heart really breaks for people that have no mental health experience and aren't in that field. It would be very challenging and overwhelming to try to just get the right answers. And I have struggled with it too. I've had to be very assertive at times to be like, okay, like, this is what I need from you guys. Even right now, they're pushing to discharge Taryn, and I said, I'm not comfortable bringing her home until you can find a med that knocks her out and keeps her asleep at night, because that's the time that I can't supervise her completely. I have to sleep, I'm basically her 24/7 caregiver, nurse, security guard, therapist, all the things. I don't even feel like I get to be mom anymore. And so that's been my ask since she's been in this last week, is find a drug that can help her sleep at night so that myself and my son can sleep peacefully at night, knowing that she's safe and that we're safe. And then we can have the energy to get through another day, because we are in straight up survival mode every single day. There is no such thing as thriving in this household right now. It's just, how can we survive between our amazing psychiatrist, outpatient psychiatrist, and our amazing community mental health nurse? They're all going to check in with me. How can I get through the next day or two? And often I can't. I have to phone them and reach out and say, okay, this is what's going on. Can we try something else? PRNs, which is a huge toolkit solution for me when she's really escalated. Those are just meds that you can take as needed. So she has a few different options, and those don't work. And we've cycled through a ton of different ones of those. It's like, I feel lost at home sometimes when her behaviors are so concerning and safety is such a factor, and I don't have a toolkit or a strategy at that point to help. And so that's why we've had to end up in the hospital often, because it's like, I will try to manage as many days as I can at home. I call our psychiatrist. We're in very close communication all the time. And I'm like, okay, I'm trying all these things, but basically this is what's happening. And she'd be like, okay, I think it is time that you guys come back in. It's at that unmanageable safety risk point again. So that's how we keep cycling through. And it's just so heartbreaking, because she was about to start high school. So she tried to do her very first day at Bedford Road in the city, and she couldn't do it. And so she had to switch to online school, which, when you come from a really smart kid mentality, coming down to online school with just a regular stream is not as engaging and challenging, which at this point, that's probably a good thing for her, because she doesn't really have, when voices are screaming in your head 24/7, it's really hard to concentrate on anything. So she's remarkably been passing everything, but not excelling in any way, which that is her norm. And she's had to give up dance. She tried at the beginning. We were like, well, let's just try 1 or 2 dances, and we just couldn't make it work. So she's had to give up everything that brings her joy in her life. So now she's sort of at the point where she's like, maybe Taryn herself doesn't want to live anymore, because this sucks. It's been months of me being like, you can do it. Let's get through the day, and eventually you just want to give up because it's too hard. It's just too hard.
Are you and your son talking and seeing professionals? Because I'm sure this must be exhausting on your mental health.
Yeah, it's been incredibly challenging for me. I took a leave from work, and then I took another leave from work, and then I eventually had to resign, because due to the role of a crisis worker and the shift work that was involved, it just wasn't something that they could accommodate me coming back to work for. And so I don't have benefits, and so I haven't been talking to anyone. I go and sit in on a lot of Taryn's sessions with our counselor, and that's very helpful, because But it's more so like, how can I support Taryn? That's what I'm learning in those sessions. I really haven't had a chance to unpack my own trauma and emotions and feelings. And I don't plan on it until we're a bit further through. I literally put it in a box on a shelf somewhere and we'll deal with that when I can. Because right now I can't go there or I might fall apart. And in terms of my son, he is just the most caring, loving, sweet. I mean, he lives with females his entire life. He's just such a softie, and loves his big sister so much. And it's been really challenging for him too. But I do actually have him booked in to start seeing our counselor in March because he needs some extra support to help him process too.
I bet. Yeah. And what's in LA that you think might be helpful?
Well, I'm an out of the box thinker and I am a researcher. So I have been like collecting as much data on what's been going on as humanly possible. I just like to like dive right in there, and actually was a research assistant for a while. So I really just love that world. And I really can't find any comparable case studies to what Taryn has been going through. And so I'm like, if there's not someone that has been through the same similar thing, like, are we sure we have everything right? And like I told you before, I have this feeling in my gut that like maybe we're still missing a piece. And so I can't exactly remember how it came into my lap, the Amen clinics, but my mom either sent me the link, or for a month or two before we really started committing to doing the scans, I had started to like look into them. And then and I'm a really huge believer of like things fall into your path and they just align the way that they're supposed to. And my mom was actually at a audiologist appointment, and the lady she had been talking to that was helping her happened to have two people in her life that had been to this Amen clinic. So she had like a one-on-one conversation with her about their experience, and it was amazing. And so I was like, okay, I'm just going to do a consult call. Like, what does it hurt, right? Basically, there are these psychiatrists that do SPECT scans. So it's a special scan on the brain that actually looks at what part is functioning too much, what's not functioning enough. So when you're actually using your brain, it's showing you the areas that are being used, versus MRIs and CT scans that just look at the hardware structure. So Taryn has had both of those scans, and structurally her brain is perfectly fine, which we know she's got functional neurological disorder. So we need to look at the functioning of the brain. It only makes sense to me. And this website, their very first opening line is psychiatry done differently. And using these scans along with the whole, family assessment workup history, they don't just use the scans, but adding these scans into their assessment process has created like 85% outcomes of patients that visit these clinics and report back a way higher level of quality of life, I guess, post treatment. And so I did the 30-minute consult, and the lady at the end was just like, yes, Taryn sounds like the exact kind of candidate that we need. A kind of a mysterious case, a very sudden onset that's still a huge piece of the puzzle, and no treatment seems to be really working after this many months. And so, I did some more reading, and I reached out to a couple people that I knew had found out through the online world, had been down to the clinic, and everybody that I had talked to said they had really amazing results. So as a mom, and an advocator, there's just nothing that you wouldn't do for your kid's health, right? Like, I've watched her life be completely destroyed. And so it's my mission to make sure that we're getting her all the resources that we can. And I kind of made peace in my mind. Like, if we go down and we do these assessments and they come back with the same diagnoses and the same kind of treatment plan going forward, like, am I going to be okay with that? Because, it's a huge financial investment, which thankfully the community has just like wrapped their arms around us and helped us raise the funds. So it won't be a burden to my family. But still, it's still a financial investment. And, am I going to be okay with that? And the answer is yes, because then I know I've still turned every single stone that I can to make sure that we know what we're dealing with.
Yeah, it's worth the second opinion for sure, whether it's the same opinion or not.
Exactly. Yeah. And this psychiatrist so then we did a 30-minute consult with the actual doctor, who is a child psychiatrist, and he specializes in functional neurological disorder. And he too confirmed, like, yes, Taryn is going to be such a great candidate for this. And I flat out said to him, like, I'm a single parent that's currently unemployed. So if I'm going to make this, commitment, please just tell me straight up. Like, I know you have to try and sell your guys's because they pay for everything. So I feel like it's kind of salesy at the same time. But I was like,
Right.
just don't bullshit me. Like, should we come or not? And he straight up was like, I'm very, very patient centered. That is my focus, is to help people. And you guys absolutely need the help and should come. So that kind of solidified it for me. I was like, all right, I had no doubt that we would be able to make it work some way. So
He wasn't like, you buy two, get the third one free.
Nope,
Like,
he wasn't salesy at all.
Okay, good. Okay, that's good.
Yeah.
And for $10 more, we'll throw in
right, a free breakfast.
That's good. I couldn't think of anything. That's good. Damn. That
Yeah.
I when I talk to people like you, I just feel so grateful that my family so far
Totally.
has the health, and yeah,
Yeah.
because
I
wow.
know. It is so bizarre how, and I guess we hadn't in my family really dealt with any health concerns before this either. And of course, every human out there that has dealt with any type of health crisis, whether it be physical or mental, understands that sometimes it can be one day you're fine and the next day you're not.
Mm-hmm.
But when it, just like everything else, and I have a lot of empathy. I've worked in a lot of fields that, are very people focused, and my entire life is revolved around helping people. I love it. It's what brings me joy. But that was still always looking from the outside, being like, oh, I'm so sorry you're walking this path. I wish I could help you, but never really truly understanding what that meant for them. And I feel like this experience is going to make me such a better social worker, because it's like, okay, I had walked through other hard things already in my life. I'd been through divorce and like single parenting, and I could relate on a lot of other levels, but not the health level. And really at the end of the day, your health is all that matters, because nothing else in your life can continue on if you're not healthy. That's the bottom line.
Mm-hmm. Well,
Yeah.
that's an interesting positive spin, because you have to
Mm-hmm.
look at the positives, and
Yep.
yeah, that's amazing that you're going to be an even better social worker than you were before. And
Yeah.
I think people will appreciate that, because when I worked in addictions, people loved, or like clients liked people that worked there that had that life experience and knew how to go
Exactly.
through it. So
Yeah. You
yeah,
become so
that's
much more relatable, right? When you've actually, the lived experience lens is like no other.
yeah.
Yeah.
It's you can't read that in a book.
No,
Not
exactly.
no offense to anyone that doesn't
Yep.
have the life experience.
I love books and I love reading, and I'm totally pro all those things, but it only gives you a certain level of understanding. I had no idea. And even from a caregiver aspect, I have had friends that have been caring for ill family members, and never has it crossed my mind that I need to be a support to them, other than like, how you doing? You want to go for coffee or whatever? I just didn't know how overwhelming and all consuming that role can be. And so now I also know that going forward, I'm going to be able to walk alongside people that are going through similar things so much better, knowing that you don't just ask people what they need, because the answer is always going to be, oh, nothing, I'm good. And even
Yeah.
if you say, oh, would you like me to grab your groceries? No, it's fine. I mean, that's just me. And we kind of talked about that already, how we both have a little bit of a hard time accepting help from other people. And I think that's a supernatural thing. That's not just us, unique to us, but
Supernatural?
a super natural
Oh,
thing.
okay.
Yeah, not supernatural, but a super common thing that
Okay.
people struggle with. And the friends and the family members that have just done the things, like, I'm just going to drop off food for you. I don't care if you said no, or give me your list. I'm going to Costco. Just give it to me right now. Those are the ones that have been able to support me the best, because I'm not going to answer with, yes, fill up my car with gas, or yes, come shovel my driveway. It's too awkward and it's too weird. And I'm not even thinking about those peripheral things half the time anyways. So I've just learned so much about how to be a better support for folks that are struggling going forward. Is you don't ask, just do.
Just bully your way in there.
Yep, 100%. Nobody's going to be mad at you for dropping off a supper.
Yeah.
Yeah.
Yeah, that's right. I mean, there is a such thing as boundaries,
Yeah.
but so if you are in that support role, Yeah, you don't bully your way in there like I'm hanging out with you all night and whatever.
No,
No.
you don't even ask to come in. You just drop it off at the front door and then text them saying, hey, there's food on your front door. That's the ideal. Yeah.
Yeah, right. Do you want to talk about the Teens Talk YXE part then? Like, were you doing that before Taryn was sick?
No. So
Oh.
she is really so that's, I guess, another positive about the situation that we can try to hold on to is that I've always known that I wanted to start a nonprofit and I love giving back. And as Taryn was struggling in the first couple of months, like August and September, I was scouring Saskatoon for resources of where can I get connected to other folks that have gone through this? Where can Taryn get connected? Where can we get help? Like help, we need some help. And as a mobile crisis worker, half of the role is connecting people to services. So they'll call in with a concern and we do like immediate help. How can we help you in this moment? And it's usually connecting to another service. So I'm pretty aware of what's out there. But I started doing a deeper dive, trying to find something, a support group or somewhere for Taryn to feel heard and validated. But everything that I found that was for adolescents was addiction focused. So it might be mental health, but it's also because recovery of whatever substance, you might be relying on. And that's very valid and necessary and needed, but she didn't fit there. And so I found this major gap in teen mental health resources. And one day her and I were waiting in the outpatient psychiatry waiting room, and just this idea of starting our own came to me. And for an hour, it felt like I just verbal diarrhea at every idea that quickly came to me. And Taryn was like, yes. But I was like, you know what though? Like, I know this all sounds really wonderful, but you have to do some thinking here if you're comfortable sharing your story, because I can take it and run with it, but this is all about you. So if you don't want to be that person that puts your face out there and talks about all the things, then that's totally fine. We're idea people. So, we'll move on to the next idea. It's fine. And right away, she was like a resounding yes. I want to share my story because she is the same as me. We love helping people. And if that's the only thing that we can get from this experience is to help one other person feel like they aren't weird, they aren't unusual by having these symptoms, and that they can be supported and can feel, I hate the word normal because normal is such an overrated word, but can feel like a teen, can just feel like a teen instead of feeling like something else. And she was 100% on board. Yeah.
So what's your mission, I guess, or your vision with Teens Talk YXE?
Our mission is to provide teens with awareness and resources and ways to connect, but also to add in the caregiver component, that these conversations need to be happening with your youth, starting as young as 10 and 11 and 12. I just listened to your podcast the other day with the young guy that ran across Canada, and his friend died by suicide at 12. So the conversation needs to start a lot younger. And I think a huge piece of the puzzle that's missing is informing caregivers that you need to be proactive about these conversations, not just sitting back saying, hey, how's everything going? Good. Okay. Conversation over. Or asking about it one time, like, or have you felt suicidal? No. Like, oh my gosh, I would never feel that way. And then the parent is like, okay, great. And they move on. Because we know it's a national epidemic how many kids are dying by suicide. And I don't think we've even fully realized the post-pandemic implications of just how hard that time was on everybody's mental health, let alone these developing brain hormonal teenagers. So our mission is to bring that awareness both to the teen and the caregiver about how these conversations need to be happening. And if you don't want to have them with your caregiver, that is perfectly fine. But here are the people that you can reach out to. You don't need to be doing this stuff alone. There are endless resources out there in terms of immediate phone calls that you can make to connect with someone that can help you through that really hard moment. And even being a mobile crisis worker, and Taryn knowing exactly what I do for work, I said to her one day, who would you have called if you didn't feel comfortable talking to me? And she's like, I have no idea. And I'm like, what? Of all the people, how would you not know to call mobile crisis? And so it's just so clear that kids don't know who to call, even though, you know, they know about the kids help phone or whatever, but it just needs to be constantly reinforced that if this happens, this is who you call or how you reach out for help. And so the awareness piece, I think, is a huge piece of our mission. But there's another part that's kind of more of a macro goal that I call it, even though I feel like it's essential to start planning right now. But we want to open up a step down from the Dubé kind of mental health healing facility in Saskatoon for adolescents. That if you think Ronald McDonald House, that type of an environment, a home where people can go for 30 days, let's say, an inpatient treatment program where they actually receive the therapy that they need. The Dubé is essential for kids that are an immediate threat to themselves. They aren't on any meds. They're not connected with psychiatry. They need to go to be safe and to be stabilized. So it's definitely a need to continue with the Dubé, but that's it. There is no extra therapy piece. Taryn has been in there for months and she's never received specialized treatment for OCD. She has seen the occupational therapist 3 times. She's spoken to social work maybe once. She has talked to the recreational therapist maybe once out of the entire time that she's been there these last 6 months, which they've told me straight up, like, we don't have the funding to do the therapy piece. We're here to do symptom management and send people home, right? And so that's a broken part of our system. And that is the same way as the adult side. But the adult side actually has programs that are stepped down from the Dubé. I actually managed one. I was a manager at the Lighthouse, and there's a program there that SHA funds that folks leave the Dubé, and it's actually part of the program requirement that you have a mental health diagnosis and you're coming from the Dubé, and then they would get housed in the Lighthouse and be part of a program that was called Complex Needs, and they had nursing care built in and different programming structures and stuff. So that model exists already for the adult side, but there's nothing.
Exists?
Yeah.
Oh,
the program's still, yeah. With all the changes at the Lighthouse, I'm not sure the status of where everything is, but but SHA has partnered with people to produce programs that can kind of help facilitate patient flow from the Dubé. And so knowing that the model exists already, I've actually met with the director of mental health and addictions, the community side, and sort of pitched this healing center idea to him and said, you know, if I could get a facility built through fundraising and grants and donations, would there be a potential opportunity to partner together to create some type of program? Because the only way it would function is with annualized funding from an outside source, so that we could have in-house psychiatry, so we could have social workers and OTs and all the people that need to, you know, pour into these kids' lives really intensely for 30 days or longer. And they don't need the Dubé anymore. Maybe they were there for 2 days or 3 days to stabilize. They step down into this therapeutic environment where they're getting daily one-to-one therapy based on whatever illness it is that they're treating, and where they're getting group therapy, where when you go with an occupational therapist to get a tip, like, let's build a mental health toolkit, which we have done, and it was a great tip, but we're actually doing it there with the child. So that's like, okay, let's pick from these items in our craft room and build this toolkit together, and then we'll practice using it so that when you are starting to get escalated, we'll identify in your body what's going on, we'll go to your toolkit and we'll try doing the strategies together in the moment, instead of here's the list of how to do a toolkit, go home and do it. Where we know a lot of these kids that are struggling don't always have great support systems at home. You know, maybe they don't have the financial resources to go out and buy the things that go into the kit. There's a ton of barriers to doing therapy that way. It's just not an inclusive way. And I think if we were to spend some time with these youth, giving them the skills and the tools that they need to handle the stressors that they have, maybe it's not going to be so cyclical for them. And then they're not going to just be cycling in and out of the adult Dubé too, because they don't actually have tools. They come in, they get stabilized for a day or two, and then they're sent back out in an uncontrolled environment without the tools that they need. That's not setting people up for success.
Did you get an answer from him if they would be willing to?
He said we can definitely have a conversation if it gets to that point. So I thought that was very positive, because he could have just shut me down right away. So
the Honorable Everett Henley. Is that who you were talking about?
No.
Everett Henley? No, it wasn't the minister?
No, it wasn't the minister. It was a
Oh,
director in SHA. Yeah. So
oh,
basically
I
like
see, I
a
see.
step down from the minister. So
Gotcha.
as high as I could go without a lot of work.
Well, yeah. He's probably better off. That guy's probably better to work to talk to anyway.
Yeah, they
Not nothing
actually
wrong with
decide.
Everett, but it's just a
Yeah,
politician or someone who's on the ground.
exactly. And he, like him and his colleague are the ones that actually decide where that the funding comes from the ministry, but they're the ones that actually decide how to disseminate it among the
Mm.
community program. So he would be the guy that I would want to talk to. And he, I said, I can't be the first person to have this idea. Like this is such a need in Saskatoon.
Yeah,
And he
yeah,
agreed.
it's needed everywhere. I mean, like when I what was it almost 10 years ago when I went to the hospital and they, yeah, I was in the ER asking for, I was in a mental health crisis and they wouldn't admit me. I just went home. It was like, so there's no other options. It's just go back home
Oh,
and keep doing what you're doing. And same thing when I left. It was like I was in the hospital for almost 2 weeks and then one morning my doctor came in and said, call your wife. You're leaving in an hour. And I was like,
yeah.
so I'm just going home. Like there's
Yeah.
no,
Figure it out on your own.
yeah, there's no,
Yep.
okay, all
I
right.
know. I know. It's just symptomatic and that's just so reactive. That's our entire system is like how can we, band-aid the symptoms enough to carry on, whereas this therapeutic center that I'm envisioning is more of a proactive approach. And you've come in because you're clearly struggling, but we're going to give you all these tools and these skills and maybe even have outpatient kind of coaches that you can check in with when something is escalating and you're not sure how to handle it, but you don't have to access the hospital constantly because that's actually not where you're getting the therapeutic
No.
treatment. It's actually traumatizing to be there often. Taryn has been
Yeah.
seeing some very sketchy, scary things. I'm sure it's the same way in the adult side. Carter is very scared to go visit Taryn because he's seen some things. And also, the other little rant that I'm going to go on is how the Dubé kids weren't included in the Jim Patterson Children's Hospital is a
Mm.
monumental fail on their side because they are also children and deserve to have a beautiful space like that to heal and recover in. We spent a couple nights on peds because the Dubé was full, which really was so eye-opening how it's beautiful and the environment is so impactful on your mental health. There's things to look at. There's a comfortable chair and a couch actually too for visitors to come be in. When you walk into a Dubé room, it's very prison cell like. It's very old and run down. There's no comfortable chairs. And when you spend a lot of time visiting your child or you have elderly grandparents coming in that have mobility issues, the fact that you have to sit on a tiny little plastic chair is absolutely ridiculous. There's no reason that they shouldn't have a comfortable all plastic. There's no way they can harm themselves with it couch in each room so that visitors feel welcome. There's no family space that you can go to be with your kid if you want. Like Tara was in there over Christmas Day, like the whole
Mm.
Christmas. So we would have loved to have a family room that you could have gone in and brought. We went in for Christmas Eve dinner with her and we had to sit in the mall area with everybody else, which is fine. But why couldn't there be a private family room that you would had a nice table in it, and if you want to go spend time with your kid, you can go do that in a little bit of privacy. So there's just so many things that the Dubé is lacking comparatively to needs. The funding is not there. They don't get all the donations that JPCH gets. And it's just so unbelievably obvious how detrimental it can be actually to the mental health of all the kids staying there because A, the environment is not welcoming or positive, and B, the activity level of stuff to do is it's basically like she's in a holding cell being checked in by nurses every once in a while. If something happens and she escalates, they'll give her PRNs, meds, and monitor or whatever, but there's not a lot of therapy happening, which is essentially the thing she needs the most.
Hmm. Have you been to the Regina psych ward?
No, I haven't.
I've talked to people that have been in both, and they're like, "Oh, the Dubé is gorgeous compared to this."
Yeah.
So,
Yeah, I
yeah,
know. And that's the thing is like always comparatively, there's going to be things that are better, but it just is such a disservice that we had a brand new children's hospital built and it further
yeah,
stigmatizes mental health that those kids weren't included in the hospital for children.
yeah, yeah,
It makes no sense.
yeah. They probably don't even have a psychiatrist on staff at all
Where?
at the children's hospital.
Oh yeah, in there, I have no idea if they would. No, they have psychiatrists that rotate through. Yeah, but
Oh, I see.
yeah, like if you need a consult or something, they'll come and talk to you over there. But yeah, it's just very. I mean, I don't want to diss the Jubei either, so maybe we shouldn't include that whole rant because I do appreciate what they do, but they need to do better.
I think it's fine.
Yeah.
I no, I think it's 100% fine.
Okay.
Because I mean, they know they're not.
I know.
They look around, they're like, what the fuck?
Yeah, it's bad.
Like I've worked in addictions too, and it's like, yeah, we all know, and
Yeah.
it's fine.
Yeah, and something just needs to be done. Like I'm going to advocate to the manager at the Dubay that there needs to be comfortable chairs put in. I will do a fundraiser. I will do whatever it takes to make it a little bit more appropriate and comfortable and welcoming for family members to visit their sick one, because these kids are sick just like every other kids, right? It's just their brain that is the organ of choice, and it doesn't matter that their behaviors.
Oh, it's a choice.
Pardon?
Oh, it's a choice.
Yeah, right. I know.
You said organ of choice. No, I understand.
Yeah, right. Yeah. You're right. It's not a choice, but it happens to be,
a different organ than
the pick of the day or whatever. Yeah.
Yeah.
And yet they just get stigmatized because it is their brain that's sick. But why? It's no different if it's their kidney or their heart. They're having to take medication for the organ that's ill and get a little extra support. And because the symptoms come out as behaviors, that's where the tricky part comes in. If Taryn's symptoms were her puking and having no energy and laying on the couch all day, it would be so much not easier to handle, but as a caregiver, it would be a lot clearer on how to handle that. You know what to do when someone is throwing up or has lack of energy. Those are common symptoms that most people can handle. But when the behaviors become when the symptoms become behaviors that are so risky, it makes it very hard to manage outside of a hospital setting.
Even in a hospital setting, apparently. So
yeah, exactly.
Yeah. Well, my God, I don't know how you're awake and talking to me. Like it sounds exhausting and
yeah.
Yeah.
It is, but that's a single parent thing. You don't have a choice. You just have to carry on. And there's no stopping. Every day just continues, and we try to I have another kid at home that I have to try to keep the world functioning for. He's going to school still, he's doing sports and attending birthday parties, and so I have to juggle all of that. And I have a huge support system with my mom and my my brothers and my sister-in-law. They're so helpful. I'm never going to say that I'm doing this alone. Yeah, I have a very amazing community of friends and family that help me drive places and pick up the groceries and all the things. So it's been really wonderful that way to get the emotional support that I need. The hard part is that I haven't really got much for respite care in terms of for Taryn, except for when she's in the hospital. And someone asked me the other day, like, is it easier when she's in the hospital? And immediately my answer was no, it's actually not, because every second that you're not with your kid as a parent and they're in a scary place, it's excruciatingly painful to know that, and the guilt and that you feel of leaving your kid there is so monumental. It's debilitating, to be honest. And I have to spend a lot of time like packing up stuff for her and driving in and paying for parking. And there's just a whole nother set of hard that comes with her being in the hospital. But do I get a little bit of breaks in terms of sleeping better at night? Yeah, I can when I pass out after I've gone through the guilty feelings of not being there. So
this is why I need to see a professional too.
I know. And I do have like our counselor. I'm very close with her. And the thing is, like, I have a lot of friends that are professionals. And so I do speak to my friends, about stuff that I'm going through. And I find that has been a good outlet for me. And then also doing the Teens Talk, YXE has been such a great outlet for me because it's been a distraction on times where I'm waiting in the hospital or, just by myself. I have a lot of time to create content that is actually therapeutic for me because I'm either doing research about stuff that I want to learn about, or I'm sharing my feelings about how I've been struggling. And so that in itself is like a form of self-care for me at this point. So I'm trying to just kind of fit it in with the day-to-day stuff.
Mm.
Yeah.
Oh, well, God damn it. Hang in there. My
Thank
heart
you.
goes out to you. And yeah, is there anything else you wanted to add before?
Mm.
I mean, I had a couple other questions, I guess, but they're kind of old now.
Old news. Well, you can ask them if you think that they should be answered, but
um, I guess physically, I noticed a change in Taryn just from because you the other day you posted like this
yeah.
kind of slideshow video show of
Mm-hmm.
her pre getting ill, and then
Mm-hmm.
it's like you could just see she doesn't even look like the same person.
I know.
Like
Yeah.
it almost even in her eyes, it's like who
Mm-hmm.
the hell is who's this
Yeah.
kid?
I know. That's the freaky part is that well, one of the first antipsychotics that she was on had a really large side effect of gaining weight, which is very common with antipsychotics. It's often a side effect. So she has gained quite a bit of weight in a short period of time, which is also incredibly detrimental to a 14-year-old at that stage. It's something that she really struggles with. It's something every kid struggles with to begin with is body image. And she had kind of just gotten to a place where she was really loving herself and accepting herself. And so that kind of added another layer of difficulty for her, knowing that this is a side effect, but there's not much she can do about it. But yeah, her eyes look different. She's changed her hair color a few times, but aside from that, she doesn't look like my daughter as much anymore. And
Yeah,
she's
her
missing
color,
this.
like
Yeah,
her
she's
color in her
very
face.
pale. Yeah. And I'm not sure, like, she's on a lot of meds and
Yeah.
she's changed them like 12 plus times. And it's that just,
Oh my
there has to
God.
be other implications that we're not aware of when you're cycling through that many different meds. And if they're not working, what are they doing to her? Which is something I have asked the psychiatrist, like, are we doing any type of damage in terms of brain structure? And they've reassured me that no,
Or
it's just,
kidneys and liver, like who
yeah.
knows?
Well, yeah, the side effects that are listed are the risk of taking the drugs, I guess, though they're not going to harm her developmentally. But I mean, who knows, right? Like, no, who
Yeah.
actually knows? Yeah.
Man, I've been on meds for like 15 years and I think they've only been switched like 3 times. I can
Yeah.
imagine 12 in 6 months.
Yeah, because nothing was working. So they just kept, and then they keep coming up with new testing that they want her to do, which means to me that they're not 100% set
Yeah.
on this as a diagnosis, right? Which they
Yeah.
told me, stop turning every stone, Pam. Like, this is what the diagnosis is. If a new symptom comes up, we will follow that path, but you can't keep investigating is really what they told me. But then they keep coming up with their own new treatments. She's trying like this gene testing, DNA gene testing to see if there's something genetically going on. We're also signed up for like a new research project out of the University of Calgary to do pharmacology testing using your DNA to see if there's like a drug that interacts poorly with your cells, or I don't really know all the scientific terminology, but they're continuing to ask us to try to do these other testings because bottom line is functional neurological disorder is a catch also for I don't know what the fuck is going on. That's actually what I think. So I think it's a little bit of a collection pot of like we've tried everything and we don't know, so we're going to put it in this category.
Yeah.
I could be wrong, but it feels that way.
Yeah. Well, I don't doubt it. I mean, psychiatry and psychology, like it's more of an art form than a science. I mean, there's a science to it, of
Totally.
course, but like,
Yep.
who the fuck? No, like it's
Yeah.
not like taking a blood test and going, oh, here it is.
I know.
Yeah.
Yeah, that's the hard part is that every single person's system reacts so differently to every single drug. And it's a long process to find what works for you because you got to wait 6 to 8 weeks till it's in full effect. And then you try something else if it doesn't work. And then you got to wait, then you got to titrate it down and up. You can't just stop cold turkey. Like it is an art form. Definitely.
Yeah. It's a lot of trial and error.
I would like to maybe just share quickly about the monthly sharing circles that we are hosting for teens.
Yeah.
Because that's kind of the one thing that actionable thing that we're doing right now. So we're hosting these monthly sharing circles. Currently, they're at different venues every month because people are offering to help us and are providing free services or very, very low cost to us services because I really want to keep as barrier free as I can for the teens coming. I don't want to charge. That's been an option. People were like, well, just charge $5 or $10. And I'm not interested in doing that. I want to keep it free for the teens. Last night we hosted our 4th one. It's grown each month, often with new people completely. So that's exciting because it's reaching different folks. And we had a guest speaker come in and kind of share her struggles. And then the kids, it's just remarkable. It's always people that don't know each other, and they come in and they share openly about what they're struggling with. Oftentimes, Taryn actually got a pass from the hospital to come last night, so she shared a bit of her story. And like lots of times, it's very, very tough stuff that these teens are opening up about with complete strangers. It's literally magical to sit there and be able to facilitate this, because it's just a different generation than what we grew up in. We would never have shared openly about those type of struggles with complete strangers, let alone our closest friends or our family, right? That was just not a topic talked about. You just didn't talk about stuff that was tough for you. And so these teens come in, and we usually do a little activity or a guest speaker, and then we open up the floor sort of for a sharing circle. Somebody starts, and I let everybody know kind of the preamble of it's a safe place and confidentiality and all that stuff. And then I just let them know that they do not have to share. There's no pressure. If they feel comfortable, great. If they want to pass, also great. It's just really teen and peer led in that circle part. And everybody shares. And they all just like talk about what their diagnosis is, or what they've been struggling with, or what happened at school that really caused them a lot of pain. And it's just so beautiful. And then it usually evolves into, how did you cope with that? And like, what are some strategies that you use? So I try to sort of end the circle on a little bit of a positive note and a takeaway for kids. Like 1 month, Taryn shared about her mental health toolkit, which is like a physical box that we have that's got stuff in there that helps her ground her, and just a little tip to take away with. And it's just so amazing to see these kids. It's kind of like you build it and they will come sort of mentality. Like they're coming and they're sharing and they're connecting, and it's just incredible. And I'm really thankful to be able to be hosting those each month, and I hope we can continue growing. And my hope is that I can actually start a caregiver circle at the same time in a different space. And because I would love that. I would love to go to talk to other parents that are struggling with their kids and saying, how are you doing? And how are you coping? And what are your tips? And just all those things, because I don't get to talk to folks that have gone through what they're going through, what I'm going through with Taryn. And so I'm hoping to be able to eventually branch that out. And these kids, a lot of them, their parents are driving them and then having to sit in the parking lot and wait for it to be over. So if I had something kind of going at the same time for the caregivers and then a different room for the teens, I just think that would be such a nice compliment.
Thanks, Pam. And thank you, Taryn. Just so you know that Pam did go to LA. They did get the test. They went to the place there. I can't remember what the name of the place is. And they did confirm that it's like extreme case of OCD and functional neurological disorder. So Taryn is doing better, and they're on the right treatment path, and they've been doing amazing things with the mental health community in Saskatoon. So you can check that out in the show notes. And remember, take your meds and stuff. Be sure to subscribe and to like this video. You can listen on Apple Podcast and Spotify. This is Todd Rennebaum saying, make your beds and take your meds. Keep watching for more interviews with incredible people telling their stories of resilience and adversity with mental health and mental illness.